Welcome to this medical case study analysis of a critical chest trauma patient. We'll examine the key findings, likely diagnosis, and required interventions for this emergency situation. Let's start with the initial EMS report at 0900. The patient experienced chest trauma and was transported via stretcher from a disaster scene. The most concerning finding is uneven chest wall movement during breathing, with the right and left sides moving differently. Initial vital signs show a heart rate of 78 beats per minute, which is regular, and a concerning respiratory rate of 34 breaths per minute, with shallow breathing. The patient is receiving supplemental oxygen at 6 liters per minute through a face mask. Let's analyze the key clinical findings that suggest a serious chest injury. First, the paradoxical chest movement, where the chest wall moves in an unnatural pattern during breathing, strongly suggests either a flail chest or pneumothorax. Additionally, the diminished breath sounds on the right side, combined with the patient's respiratory distress and temporary breathing cessation, point toward a likely tension pneumothorax. Let's examine what happens in a tension pneumothorax. In a normal chest, both lungs expand and contract evenly during breathing. However, when chest trauma creates a one-way valve effect, air enters the pleural space but cannot escape, causing progressive lung collapse and mediastinal shift. This increasing pressure compromises both breathing and cardiac function. Given these findings, immediate interventions are critical. Emergency needle decompression of the right chest is needed to relieve the tension pneumothorax. The oxygen should be increased to 100% via non-rebreather mask. We must prepare for chest tube placement and possible intubation given the respiratory compromise. Continuous cardiac monitoring and access for fluid resuscitation are also essential.